If you're getting value from working healthcare, I have a quick ask. Follow the podcast and leave a 5-star review on Apple Podcasts, Spotify, or wherever you listen to the podcast. That simple action helps more physicians and leaders find these conversations and better understand how our healthcare system actually works. And that matters because we can't fix what we don't understand.
You ready? You got me running.
I am Meredith Hirsh, and this is Working Healthcare. Menopause-related symptoms cost the U.S. economy an estimated $1.8 billion annually in lost work time. I just interviewed Maryon Stewart. I call her the Queen of Menopause. She even has a PBS special called Maryon Stewart's Menopause Solutions. This episode examines why menopause remains under-recognized despite decades of scientific research, why women continue to struggle to find evidence-based care, and what structural changes are needed to close the gap between research, clinical practice, and patient care. This is one of my favorite episodes I've ever recorded. You do not want to miss it. Maryon Stewart, welcome to Working Healthcare.
Thank you so much. I'm actually really excited today because this is the first time I've actually been in a studio for so long. We live on Zoom.
We totally live on Zoom, and I am so excited to have you. I've been talking about you for months because this is a topic that hits close to me and all of my friends because we're all about the same age. And even if my friends are 10 years younger, they're starting to see this, as Janine, my producer, has shared. And and those who are older than me are still going through this process. So it's menopause. And I know all of our husbands that we're married to are going through this process with us. So it doesn't just affect women. It definitely affects the men in our lives as well. Even my son said to me the other day, "Mom, you've been really different for like a year and a half." I'm like, no kidding. And I am trying to find a specialist to seek out, to go to, and I can't find them, but it's all over social media. Why is it more of a social media influencer topic? And why is it so difficult to find a specialist to work with in the menopause world?
Have you got a week for me to answer that question? The fact is, I think one of the things that hit me was that a lot of empty nesters become menopause coaches. And then they think, it'd be quite nice to get in front of the camera. And so I'll go on Instagram or TikTok to get a following. There is so much to know about this subject. I mean, I started helping women actually 40 years ago, which is a long time, helping them with PMS first of all. And then when the research came to help them with menopause as well. But there are thousands of medical papers. And I focus on the natural approach to menopause. And that's even worse because most doctors and healthcare professionals don't even learn that subject. You know, they get a few hours in the undergraduate. And so nobody really is up to speed on what's going on. And women are just left being bowled over by their hormones and really not knowing where to turn. And that's why I get out of bed every day. And that's why I'm still doing it. Because as we were saying just before we started, we're both driven by a sense of injustice. And I can't walk away from this because I know that if you find the right information at this time in your life, it can be completely life-changing on so many levels. And 100 years or so ago, we weren't living much past 50, and so it didn't matter. But now, when many of us reach 90 or 100, you know, you've got all these extra years. You haven't just got to worry about menopause. You've got to worry about your bones, your heart, your memory. What doesn't go on below the waist unless you fix it? You know, there's so many things that we need to think about, and we need proper information that's going to be effective.
I'm in healthcare, and I knew nothing about menopause, and I just sort of brushed it off like, oh, this is just an excuse that people give. This is just an excuse that women give. I went off the birth control pill when I was 43 years old. I'm going to be really authentic with this story. I never got my period again. And I'm like, what the hell? And my friends were like, you're so lucky. You never went through the symptoms. You're so fortunate. I'm like, I have no idea when I started going through menopause, because literally at 43, I was full blown in, never got my period again. Is my story common?
There are women that go into an early menopause. Sometimes it's called premature ovarian failure. It's not uncommon because when you're on the pill, you're not ovulating. And so maybe your body forgot how to do it. I have had patients years ago when I was in my practice in London who had come into the clinic in that kind of situation. And once we got them back into good nutritional shape and I taught them how to consume plant-based hormones, their periods came back. And I even had a few who were infertile who went on and had babies in their 40s. So it's not necessarily over if you do other things. But even if you do go into an early menopause, and perimenopause happens in your 40s anyway, and you need to learn how to meet your needs right at that point so that you don't go down the rabbit hole.
Why are so many women blindsided by menopause?
We did a survey going back about 6 years in the UK with the Daily Mail. We did 5 big surveys. The first one was completely overwhelming. I'd been out of the field for 6 years because I was running a foundation in memory of my daughter. And I came back and I thought, well, what do I do now? The world's changed. Social media is everywhere. I don't have a following and I'm not sure what to do. So I used to write for the Daily Mail and I went back to them and said, if I do some surveys, will you give me some space? And they were wonderful. They gave me the front cover of Female and pages inside. The first survey we did, we found it was on 1,000 women. 96% of them said they felt unprepared for menopause, and 2/3 of them said they felt robbed of life as they knew it. I cried.
That's how I felt. I had my kids young, so I feel fortunate in that respect. But I never in a million years, I didn't want any more kids. But I felt like I lost something, like I lost that opportunity. My mom had my little brother at 42, and I was done. Like, I didn't have a choice. And I was so unprepared and didn't know what to expect. I knew about PMS, but I certainly didn't know about menopause. How did you even get involved in this whole world?
Well, that's an interesting question, and one that I look back on and think, it's like, how do these things happen? I trained as a dental hygienist in the beginning. I was married to a doctor in England who was specializing in nutritional medicine. And so he and 3 other doctors were setting up the British Society for Nutritional Medicine. They gathered together 10,000 medical papers, and they gave them to me. I had 2 babies. I just had another baby, so I had 2 under 2, and they didn't think I had much to do. So they got me to sort them. But I actually found 200 papers on PMS and on the non-drug approach. And so I made a program from that and plugged it into our practice nurse so that I thought, my husband could be another part of his practice. He can help women. And it was just one of those things, really, a journal. In fact, then I discovered that women were waiting between 6 months and a year before they'd get any help because there were long waiting lists. And even when they got to the front of the list, the most they were either given was hormones or antidepressants. Like, no one was getting anything good. And so we decided that we would send our questionnaire out to women who needed it wherever they were. And before I knew it, we had a journalist who wrote about it. She came as a patient, she wrote about it. And then the whole thing, that was just a local newspaper. But then before I knew it, was Cosmo, the News of the World, which was like his massive Sunday newspaper in England. And we had literally sacks of mail arriving. I mean, over 2,000 letters in one day. It was before emails. You can't imagine how long it takes to open those. And the stories that I heard about women who felt even suicidal. They were afraid they were going to hurt their kids. They were on the verge of divorce, for 2 weeks a month. And then they flipped back to being normal again. And so we had to get organized. I felt we had to get organized to provide help. And so we set up the first telephone. Well, at first it was just postal, but in 1987, going back all those years, we set up the first, I think, telemedicine, telephone consultation service. And we had women bear in mind, I was in England. We had women as far away as Australia and New Zealand on our program. You know, it was just helping women all over the world. And then I remember going on a book tour, and I was in Australia. I was in a library in Melbourne, which was a new women's library. And the photographer kept saying to me, put your arm back, put your arm back. And I'm thinking, my arm's going to break off. And I looked around to see where my fingers were. And I was touching 2 copies of our PMS video. And I'd only ever had 5,000 made, and we'd given them all away to women's groups, and I owned 1. And here I was, halfway around the world, the other side of the world, touching. And I realized, you know, that information was so needed, and we really were reaching people.
Fast forward 40 years later. What are women still telling you? What are you still hearing from women? And you're like, really? This hasn't been resolved yet?
Well, that's what happened to me when I came back in 2017, after I'd been out for 6 years. I couldn't believe the survey data. I mean, we did a sex survey, a relationship survey, and over 80% of women couldn't have an orgasm. They had vaginal dryness. They didn't care if they never had sex again. They were just, it was awful. And then we did a survey on men, and the men said they felt frustrated and they felt sad and scared that they didn't recognize the person they were living with. And there was this total disconnect. No one's talking about it. And so you don't even talk to your best friend about your libido, the fact that your libido is less or gone, or whatever it is that's very personal. It's the white elephant in the room. And so we know from all the research that's been published that you can fix all of that. You know, you can fix your mood, you can fix your hot flushes, you can fix your lack of sleep and inability to sleep and your brain fog and your aches and pains and your lack of joie de vivre, because people flatline. You know, they feel like they can't experience joy anymore.
But women don't know where to go. And I'm a prime example of this. My mom passed away in February of metastatic breast cancer. And yes, and it was driven by estrogen. And so I thought, oh my gosh, this is somebody looking over me. There is a reason why I went into early menopause. I am not supposed to be producing estrogen. And okay, I'm 43 years old at the time. I'm like, it's fine. But I now am 51, and I have seen this progression over the last 8 years and gone, yeah, I am totally a different person now than I was at 43. And I was dismissing it for fatigue because of this, because I'm so busy. And it's hard for me to open up and share these stories. And I spoke to my gynecologist, who I saw once a year, and that was it. And she kept dismissing it. And it wasn't until about a year ago, and through this podcast and working healthcare and meeting so many amazing women like you who are specializing in this area, because this seems to be very difficult to find. My gynecologists have dismissed me. And when I've tried to do research to find a specialist, I'm coming up with chiropractors, nurse practitioners, like nobody focuses on this area. Why is it so difficult to find a specialist?
I honestly don't know the answer to that. There are people out there. There are, especially the UK and the US are different. You've got a lot of doctors here who are involved in this space, who are doing, some of them are focusing on hormones, some of them are focusing on the natural approach. But I started researching something, in fact, I had a book published 31 years ago called The Phyto Factor, because I was bowled over by the amount of research there is on phytoestrogens and their application to our health, not just our hot flushes and night sweats, but so many other aspects: our brain health, our bone health, our heart health, our blood glucose health. There's, you know, so many things. And I wrote this whole book on the subject. And since then, there's been so much more research. And now we've put together a phytoestrogen food guide, which gives you all the foods that you can choose from, the exact amounts per serving, and deep instructions about how you need to consume them and choose so that you've got a certain number every day. Now, that doesn't exist anywhere in the whole world. Don't ask me why. You've got the government lists of foods, which is like this great big tome. And even on food labels of the phytoestrogen-rich food, it doesn't say how many phytoestrogens are in there. So people are completely clueless. And I was just talking to someone in my team the other day, and she was saying there's a new book being published by a nutritionist in New York, and it's on the bestsellers list. And while I was on the phone to her, I downloaded it, put it on my Kindle, went through it, and yes, she's got some great information in there. But when it comes to phytoestrogen, she just listed out the foods. No values. Some of them don't even contain, they contain a trace. It wouldn't do you any good to consume them. There's no medical references in there. She's completely missed the boat. She's missed the opportunity to really empower people with knowledge that's going to help them not just with their menopause, but it's going to help them post-menopause as well to keep themselves healthy. And that makes me, it just makes me a combination of completely sad and completely furious because it's needless.
And I don't even know where to go. And I know people listening to this podcast episode don't know where to go because there's so much information out there. You listen to social media and there's so much misinformation. Maybe some of it is accurate, but a lot of it is inaccurate. You have doctors who disagree. My husband is a rheumatologist and he is now finally doing some research on the topic because it is impacting him personally because he lives with me. And and I listen to, if I ask one gynecologist, he or she disagrees with the other gynecologist down the street. How do you get accurate information?
Okay, so the way we do it is we follow research. So what we specialize in doing is joining the dots, bringing all the research together. So the Phytoestrogen Food Guide, just as an example, we've got 12 doctors who've endorsed it. And, well-known doctors who have looked at it and said, wow, this is amazing. And yes, this is what we should be giving out to people so that they can have a better understanding. We've got a standard daily protocol, which is completely based on research so that you go to your practitioner or your doctor and they say, you've got to eat a better diet. You've got to live a healthier lifestyle. And you come away thinking, well, that's great, but what does that mean? So our standard daily protocol is very explicit about how much protein do you need, how much fiber, how many polyphenols, what about probiotics and hydration, as well as the phytoestrogens, and then what about lifestyle and how much of this kind of exercise and weight bearing and strength training and all of this do you need to do to maximize your well-being so that you can go from feeling like a shadow of your former self to the best version of yourself?
To me, this is a lot of work. And I'm willing to do work, but I'm like, is it really all about just food?
It's not a lot of work. Honestly, I'm telling you, it sounds scary, but it isn't. It is the most enjoyable thing you can imagine. We just finished a pilot study. 6 months ago, we finished a pilot study where we had 32 women. We were validating what we call NHRP, which is the natural hormone rebalancing protocol, with biometrics. So we worked with Ultrahuman and Samsung and with their rings. And the women were motivated because they could see what was happening to their temperature, to their sleep, to their energy. They were actually tracking it. I don't promise anyone anything, but within 2 or 3 weeks, the women and we chose very severe sufferers because obviously we wanted to see the maximum impact. They were just saying they were reset. Like by the time they got 7 weeks down the line, most of them were sleeping through the night. Hardly any of them had any symptoms whatsoever. Brain fog had lifted. The hot flashes had diminished. It was just like a whole different ballgame. They weren't aching anymore. And they could see a light at the end of the tunnel. So that 20% of women leave the workplace because they get bowled over by their hormones. 20% of talent.
Yeah.
Imagine how much that costs. Not just you personally, but industry as well. It's just a horrendous situation. So these women were all powerhouses. They'd risen up the corporate ladder and were real stars, but they were just feeling that they couldn't even show up for work anymore. They were too scared because they were making mistakes. They couldn't focus. They were embarrassed. It was awful. So to be able to turn their lives around in a matter of months feels to me like it's actually addictive. You know, I feel really, really lucky to be in the situation to have that as my day job.
Definitely sold me. What about peptides? I'm hearing a lot about peptides right now. I don't even really quite understand what peptides are, but does that have a play with menopause?
It does and it doesn't. There are all kinds of things that have come, and based on research, we tend to make recommendations that are really sound. And yes, there are peptides, there are all kinds of things that you can use, but it doesn't have to be very complicated. As long as you have plenty of protein in your diet and you choose the protein carefully, you have some fiber and make sure that you've got plenty of colored fruit and vegetables for your polyphenols, and you have some probiotics because the gut's really important as well. You can have the most enjoyable diet. And I've got so many recipes, but I know a lot of people hate cooking. And so I did fast options, which we put in the community. And then I thought, I didn't even know if these are too complicated. So then I wrote a whole load of no-cook options. So you can just go into a store, and if you know what you're doing, you can buy the right things, put it together. You don't even have to cook. And there are a few amazing things like energy balls that you can mix up in a bowl, which are delicious and sweet and so good for you, that will give you not only energy, but clarity of thought and help you to just feel good and carry on with your day. And doing things like taking a break and doing some relaxation. Hardly anyone who's busy does that. They say they haven't got time. But actually, if you do a guided meditation for half an hour a day, it's going to actually reboot you so that you're going to be good for the rest of the day and much more productive. And the same for exercise. You know, you need to find what you love. I love my hula hoop. I love walking with my dog. Do you know, I love water aerobics and crazy music. It's not a chore when you find an enjoyable way forward. And the trade-off is that you get rid of your symptoms. You suddenly start feeling amazing. Below the waist starts tingling again and everything's fine. Do you know, and life becomes, wow, the light bulb goes back on again, you know, and you feel confident about aging. You don't feel like you're falling apart and you're old. I mean, I'm in my 70s now, and I just feel
You have more energy
ageless.
than I do. You know, it's funny. My husband and son have been on this kefir journey, and they're constantly labeling it with, you know, don't touch until Saturday, and they're mixing it up. And I'm like, we have strainers that are in right next to the sink because they're always straining the kefir and doing this. And in the morning, my husband's like, hey, you want to have some of the kefir? And I'm like, no. But I think after this conversation, I will be taking part of the kefir.
You can, but you know what? You don't have to. You can keep this really simple and enjoyable and still get through. That's not to say you shouldn't do it, because if you feel inclined to do it, that's absolutely fine.
Yeah, I'm not a big kefir
But
fan.
all I'm saying is it doesn't have to be complicated.
The NIH Revitalization Act became law in 1993 in the U.S., and I know you were not in the U.S. in 1993. No. I think, you've been here for 14 years?
Yeah, coming up to 13,
okay.
Yeah.
And I know you still share time between Britain and the U.S., but why hasn't requiring women in research, because that's what happened in 1993, but why hasn't it translated into better care for women?
I still don't think there's enough research on women. Most research that's been done in the past is on men, and we're not little men. And these days, there's so little money. And the money has been, what budgets there were got cut. And that's my biggest bone of contention, because that's the only thing that's ever stopped us from advancing, is the lack of funding. It's insane.
Do you think that the information breakdown happened from the research? Because research funding really, it's probably been the last 2 years. But is there a breakdown in medical school or residency or continuing education once doctors are finished with their formal, I want to say, education? Or do you think it's reimbursement for this type of medicine that has caused a breakdown? Or is it the fact that there isn't a lot of time with patients and specialists have to be in and out and they just can't have this conversation with patients.
I think it's a lot of those things. But if you think about it, when a doctor graduates, most of the postgraduate education they're going to get is funded by the pharmaceutical industry. And it's not really in the pharmaceutical industry's interest to promote a dietary and lifestyle approach. And really, the dietary and lifestyle approach should be the first thing that you do, because you can alleviate a lot of your symptoms. And not only that, but it gets you out your chair and it keeps your bones strong and it keeps you flexible and balanced on so many levels. And I think that is completely missing. And it's even now, I would have hoped that, in fact, when I came back after being out for 6 years, I thought there would be much more education for doctors. But when I did those surveys and I heard what the women were saying and what the men were saying and what the workplaces were saying, I was appalled. And I actually went onto Facebook and started making films on Facebook. This was going back 2017, 2018. And all I did was sat there, made a film talking about perimenopause and menopause and the fact that women are needing help, but they're not getting it and that they're not alone. Mm-hmm. Do you know what? I got over 1 million views for those films in the space of a year. It was shocking.
Because there's nothing out there. We have, or physicians have, required continuing education on everything you can think of regarding HIPAA or drug abuse, opiates, everything.
Yep.
Do you think there should be required continuing education on menopause?
Yeah, I do. It's not just menopause, though. If you think about it, you've got perimenopause starting in your 40s. That takes you through, that can last for 10 years. So the average age of menopause is 51, and your menopause is only one day. It's the anniversary of your last period. Mm. And then you're postmenopausal for the rest of your life. Now, the rest of your life can be another 50 years.
Yeah, especially me, right?
And so of course they need to be focusing on it. Of course they need to be looking at from my perspective, everyone's busy. What we need to do is take the research and then work out what's the minimum you can do for maximum impact so that people can adopt those things as new habits in their lives and have extra hours of thinking clearly and having energy. You know, instead of just falling asleep on the sofa or feeling grouchy or feeling like you can't get out of bed in the morning because you literally have been up and down all night because you can't sleep, you're having hot flushes, and it feels like the morning feels like a nightmare. It doesn't have to be like that.
Do you think there should be a specialty or a fellowship in menopause? I don't think there is.
Yes, and I think the thing that really upsets me is that if you go and see an accountant or a lawyer and you ask for an opinion about something, they'll give you an answer based on all the research. But if you go and see an OBGYN, someone who's supposed to specialize in menopause, they haven't got the faintest clue about the lifestyle side of this. And I'm telling you, there are hundreds and hundreds, if not thousands, of medical papers published on this. You know, every month we update our research, and every month there are gems being published in very prestigious journals. And it just makes me want to weep to think that those are just behind closed doors in postgraduate libraries, figuratively speaking, because no one's reading them.
And nobody's sharing the information. So I was told, because of my mom's breast cancer diagnosis, and it was estrogen driven, that I cannot be on hormones. That to be on hormones is going to increase my risk of breast cancer by a large percentage. I went back to the same geneticist that I had gone to 15 years prior. And she said, you know what, Meredith, you went into menopause so young, you can be on it for 5 years. Now, it took me a lot of courage to decide to take hormones because I'm feeling the symptoms myself. And after my oldest son literally was like, Mom, you've been really different the last year and a half. I'm like, you're right, I have. And just processing all of this, I decided to go on hormones. I can't even tell you how challenging it's been. And I did speak to my gynecologist, and she put me on progesterone and estrogen, but she didn't tell me I'm going to start bleeding again. It's like, what the hell? And I was at my aunt's house, who's, by the way, in her 80s. And I'm like, how am I getting pads here? And she happened to have them, which shocked me because I was the youngest one in the house at the time, the youngest male or female in the house at the time. And then we talk about testosterone. You have to get it compounded. It isn't even FDA approved. And the first compounding pharmacy that my gynecologist sent it to called me and told me that they're no longer compounding testosterone. So it's a game. It is so difficult to do this. So very excited. I did a lot of research trying to find somebody in the local area. And that's where I started this podcast. It's chiropractors who are doing this. It's nurse practitioners who are doing this. I want an MD or a DO. Like, I want a doctor who specializes in this area. So I found somebody, I'm not kidding you, an hour and a half away, who's a urogynecologist who specializes in this area, because I don't want to just go on hormones with somebody who doesn't even tell me I could bleed again. I'm like, I haven't bled since I was 43 years old. I'm like, are you kidding me? So there is a lack of information that's given to the public, and we do not know where to go. We are 78%, women are 78% of the workforce in healthcare. That's why I'm having this conversation on working healthcare. What can we do? What can somebody sitting, listening to this episode, what can they do to create change and help themselves through this process, whether they're PMSing, whether they're perimenopause, or whether they're menopause? Where do people turn?
Well, we have our website, which is femar.com, and I can share the links with you. And we have a community which is stuffed full of content. And we do interviews with we've got a whole panel of specialist doctors who specialize in everything from heart health, bone health, urogynecologists, everything, so that we can sleep doctors, so that we can have conversations about subjects that are really important, and then people can come and ask them questions. So that's kind of how we work. And then we have our protocol. We deliver some services in the workplace, and and people can just come and get the phytoestrogen food list guide. That's free. And then there's the standard daily guidance that they can join the community and pay for, get on with it by themselves. Or we have nutritionists and dietitians who can tailor a personalized protocol. So we're doing that all the time and turning women's lives around. It's just what we do.
If you could redesign menopause care tomorrow, where would you start?
Well, I'm hoping that I'm going to have a hand in that, because I'm talking to Senator Barbara Sharif at the moment, and she's got a menopause bill in Florida, and she's going to, hopefully that will go through, and then she's going to be able to curate some templates for women and doctors, and we can help to bring all the research together to make it really easy, because there's no roadmap. That's what's completely missing. And that's what we're putting together for women, so that just to make it easy.
Is this menopause bill a roadmap, or what does it entail?
No, it won't just be a roadmap, but it will provide a roadmap. So what we're doing at the moment is since our pilot study, we're now looking to train AI. So we know that women can make changes. They can use biometrics to follow their progress. And now, in order to scale it so that we can help women all over the world, we need to actually train AI. But unfortunately, a lot of the AI that's out there already makes mistakes. And sometimes it gives you good stuff, sometimes it gives you rubbish. And in fact, when I first went on to check about myself, it told me I died in 1997. It's a bit disconcerting. And you can correct it. But I've done like some work with medical references, but I'm really rubbish at formatting it. So I thought I'd just been on this AI course, so I thought, okay, I'll give it and say, can you format this? And it messed all the references up. So the references, instead of pointing to the right medical papers, pointed to something completely irrelevant. So, I get nervous. So we are training, the goal is to train AI with really good research and ongoing research. So it's always real-time research so that anyone can come anytime, whether they're a woman, a doctor, a husband, a partner, or whatever it is, and get the information that they need to either use themselves or take to their practitioner and share it, because it's missing and it shouldn't be missing. It's insane.
When women do seek help, like me, they're often paying cash. Traditional healthcare insurance is not covering this. I'm going to see the urogynecologist and I'm having to pay out-of-pocket cash, and it's an MD. Why is traditional insurance not covering this kind of care? Because
they say there's not enough research. It hasn't been validated enough. It's hard. It is hard. I mean, we have got, where we've been working with Jackson Health Care System in Miami, their insurance providers have been paying for the services in the workplace, so the employees don't need to pay for it. So I think that's a really great way to go, and we're looking at doing more of that. In fact, we're looking at doing a workplace study to validate the whole system so that we can actually get this out there to everyone, because it's completely nuts. From the perspective of a company who are going to lose 20% of their senior executives for no good reason, that's good enough alone, apart from the fact that your relationships fall apart, your self-esteem goes. Your kids look at you as if you're a bit potty. As you said, it's like, why? When we're wise women, we've lived life, we've got a lot to offer. It's just insane that we should even vaguely be bowled over and feel out of control at this time in our lives and be scared about what the future holds.
Why has menopause remained marginalized compared to other areas of medicine?
Well, I think it was probably because we weren't living much past menopause to start with.
Yeah, but that was hundreds of years ago.
No, it wasn't that long ago.
Yeah, but 50 years ago, even, I don't know what okay, let's talk about when Medicare came about. When Medicare came about, the average life expectancy was 67, and that's why Medicare started at 65. So 50 years ago, it was 67. Now we're up to about 79. But even at 67, you're still going through menopause.
But I guess you are. But I think a lot of women, if they would have left the workplace earlier, if they worked at all, and they were at home and they were just invisible. Do you know what? It just wasn't a big priority to help them. I always say that, if men went through what we go through, we probably wouldn't be having this conversation. It'd be a whole different ballgame. But it is what it is. I don't know. I actually don't know at this point how we correct it, especially in this current environment, because women's health and women's research and funding for women's research and all of that is less than it was. It's going in the wrong direction. So I'm not quite sure. So from our perspective, having all the information in one place, having a roadmap, having AI trained properly so that women everywhere, no matter what their, how much money they've got or whether they're in or out the workplace or whatever, there's somewhere that they can go to get the information to empower themselves to a big slice of good health.
I loved hearing that Jackson Memorial Health Plan is supporting women through their menopause journey. How much does untreated menopause really affect the employer?
Oh, huge amount. I mean, you're talking about the statistics show that it costs billions of dollars. You know, you've not just got lost hours at work and lost productivity and people not showing up for work, but you've also got the fact that you've got healthcare services. So I remember having a conversation with, I think it was Jackson or one of the other healthcare systems, where they were saying that on average, their workforce went to see 8 different doctors to get a diagnosis. Now, each of those consultations is going to cost between $250 and $400. Do you know? So there you've got all that cost to start with. And then what happens at the end of it, when nobody really understands what's going on, is they get into what I call the mental health bucket. So then they get, they're stressed, or they put it down to something else, depression or whatever. It's all part of the same thing. When obviously people do get stressed, especially in this modern world, and their cortisol goes up, we need to help lower their cortisol. We need to teach them how to manage and how to get back to being in good shape again, not just keep throwing more money at unsolved problems. It's just, it baffles me. I don't know. It is solvable, but we gave up. We were in England. We used to lecture to doctors and practice nurses and menopause specialists all the time. And then the budget ran out and people weren't turning up for conferences because there was no funding. And I can remember the day that I decided that I was going to focus on the consumer, like helping women who are the end user after all said and done. They're the ones that have got to get out of bed in the morning and look after their families, look after themselves, their partner, their work, and everything else. And they can't do it if they've got one arm tied behind their back and they're feeling like death on wheels. They just can't do it.
As you're sharing this story, I'm thinking that doctors are dismissing this as a psychiatric condition and telling women to go to a psychiatrist or a therapist or get on some antidepressant medication.
But it used to be called hysteria.
Yeah.
It's like it was considered to be wacky health, mental health. And of course it isn't.
No.
There are so many aspects. In the early days, the studies we did on women who had PMS, we found that between 50 to 80% of them had low magnesium stores, low B vitamins, low zinc, iron, essential fatty acids, vitamin D, calcium, and that was affecting their hormone function. And as you get older, your nutrients become in even further supply. So if you're firing on 2 cylinders instead of 4, you've got empty estrogen receptor sites because your ovaries have retired. That's going to make you feel like death. And so then you're less active and you're doing less, your self-esteem is less, it's harder to work, it's harder to do everything. It doesn't take that long to have a refuel. It really doesn't. But you just need to know what to do.
What responsibility do employers have? What do you think employers should do to help the women who work for them?
Good question. Well, what's happening is a lot of the employers now, not a lot, but a better percentage, are employing a menopause policy. And so they feel like they're ticking a box. But actually, they're not doing much apart from that. They're not really helping women in the workplace to feel better. And that's what needs to change. It absolutely needs to change. And so I'm really hoping that this bill goes through and that there are, menopause becomes top of the agenda for so many more doctors and that so many more women get empowered with knowledge because it's necessary. It's 100% necessary.
Do you think this is fundamentally a women's health issue, or do you think it's a healthcare delivery issue?
I think it's both. It's just, it doesn't just involve women. As you said before, your husband has to live with you. If you're acting, he doesn't recognize you as the person that he married, and he's, there's not much action behind closed doors at night. It's hard for men. When their women are in their 40s, the men are in their 40s and 50s too. And that's a bad time in your life to feel rejected and feel like you're not desired anymore. And it isn't really that. It's just that women get switched off because the receptor sites, the estrogen receptor sites are empty, their nutrient levels are low, and they're like a rabbit in the headlights. They don't know what to do. And so they don't want to have a conversation about it because they don't even know there's a solution.
Do current reimbursement models and the decreasing physician fee schedule play a part in all of this, where doctors cannot spend as much time as they need to with patients?
Oh, I'm certain that's the case as well. I mean, our first consultation on if we're personalizing a protocol, is an hour, and the follow-up is half an hour. I mean, they don't get that long.
It's not even an hour and a half an hour anymore. It's probably 3 or 4 patients within an hour's time.
Exactly. And there's a lot to get through, and there are questionnaires that women need to fill in so that you actually understand what their medical history is, what their medication is. You need to take so many things into consideration, what their family background is. For example, the fact that your mom had breast cancer. That there are all kinds of things that have to be taken, and that takes time. You need to consider each individual person very carefully. Unless you've got very little problems in your life and you're catching it early, then you can just take the information and run with it and do it yourself without having to have major consultations. And the earlier you start, the better, because our bone mass reaches its peak by the time we're about 35, and then it's downhill unless you know how to redress the balance.
You spent your career translating research into practical guidance. Why is it still so difficult to move the published science that's out there into everyday life so traditional insurance can cover some of these hormones or treatment plans that are available?
I think it comes down to research, because whilst there are thousands of papers, and we've got an up-to-date list of them that we've summarized, we only just did the pilot study to validate the natural hormone rebalancing protocol with all the things that you do, as opposed to, this showing it helps with vaginal dryness, this showing it helps with hot flashes, so we brought the whole thing together. So the next thing we're looking at doing is training the AI, and then another study which will be in the workplace, looking at 2 or 3 different workplaces to show that this is exactly what you do, how you do it, and these are the outcomes, so that you can look at not just saving talent, but also you look at the economic side of it as well. And I think once we get a bit further down the road, and we've talked to big research institutions about partnering with them, but we can't get the research funds because we haven't got enough evidence at the moment in terms of published research on this approach. And so for the next year or 2, we have to focus on getting more published research. We've got our pilot study being published, but then once we've got more published research, it will be so much harder to argue with. And that's what's got to happen. But finding the funds for that is tricky.
And you've talked a lot about how an injustice is actually what propels you to do the work that you do. You and I have that in common. What injustices in this world and what you're doing right now are you trying to correct?
Well, I think when I look back in the beginning, when I got called to do that PMS work, it was because I couldn't bear the fact that women were harming their kids and that their relationships were falling apart and that they were feeling suicidal when I knew that they didn't have to feel like that. And the same thing for menopause. It's like it's wrecking people's lives, their self-esteem, their potential, their ability to get down on the floor and be a grandparent. And just do all the things that they've worked so hard to do and go on adventures with their partners and have a great time. That's all doable if you know how to meet your needs. And so somehow I feel I've got to pull this off, and get these next bits of the research done so that it becomes a no-brainer and no one can argue with it.
When historians look back, I'm going to say, even in 20 years, they look back at the work we're doing right now in menopause, in women's health. What do you think they're going to say?
I think they're going to say, if they look back earlier, that there should have been a much bigger investment in women's health, and it should have been more timely, because we're just wasting time. It's a waste of everything. It's a waste of talent. It's a waste of resources. It's a waste. It's a waste of loving relationships Do you know, it's a waste of everything. It's tragic, actually.
What gives you optimism that the next generation is going to do better?
Because I know that once we've trained the AI and the information, the sound information out there based on real-time research all the time, that younger people it's so easy for them to just find that information and use it. You know, they're used to digital, they're used to AI, they're used to researching for themselves. If you've got everything in one place where they can come and get it, they'll do that. In my experience, women are craving this information. They're just nervous because they're not sure, as you said, you know, are they being given the right information? And one person tells you this, another one tells you that. It's insane. It's got to be joined up. And you've got to say, okay, this is what you need to do. This is the irreducible minimum that you need to do with your diet and your lifestyle, and maybe take a few supplements if necessary that have been through clinical trials to boost your nutrient levels and help you to fast track this. And then you'll be back to feeling brilliant again. And then you can learn how to manage your needs in the longer term. So there's research to show you can create new bone. You can protect yourself against heart disease. You know, women, it's the commonest cause of death amongst women after menopause is heart disease. And that's insane. You can die from a hip fracture. You know, and dementia is becoming more and more common. And yet there are so many things you can do to improve your memory and your brain health. Somehow we have to tip this over the edge so it becomes common knowledge. And it's not just an exclusive thing for certain medical professionals and lucky women who get to find out about it. You know, it needs to be like my video that went round the world, you know, all those years ago, where it's just everywhere.
1.3 million women enter menopause every year in the United States. So I'm going to wrap this up with positivity and a way to create change. If you had a magic wand, Maryon, what one change would you create in our American healthcare system?
I would take all this amazing research and plug it into the database, the system, and I'd make sure that healthcare professionals got trained on it. It's not that complicated. And have a system where it's updated all the time, and that there are RDs who are completely trained, up to date, who can train other people and just get the job done. It's honestly, it's not complicated. It just requires passionate people who have got some funding and treat this as a priority. And then we'd be there.
Maryon Stewart, thank you. This was so enlightening. Thank you for joining me on Working Healthcare. If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post about it on social media. Connect with me on LinkedIn to keep the conversation going in between episodes. If you've got a question, an episode idea, or someone you think I should feature, send me a note at meredithhirsh.com. Thank you all for the 5-star reviews. They help more listeners find the show. New episodes drop every Tuesday. Subscribe so you don't miss what's next. Tune in weekly as we explore the inner workings of healthcare, because you can't fix what you don't understand.